Hi everyone, welcome back for Volunteer Week as we continue our conversation with Eric. So now that we've covered the personal side, let's talk a little bit about what you wanted to specifically bring from your personal, professional experience to the KFOC as a volunteer.
I've been in healthcare for approximately 7 years now, and I've had a variety of roles from data analysis and collection to briefing notes to strategic consultation to where I'm at today. And right now I'm working very closely with physician providers in Fraser Health. And throughout my journey in healthcare, we've always had, everybody talks about a patient-centered healthcare system. And what I've always been driving in any level of role and any involvement I have been is how do we always put patients first? And that's part of what draws me to the Kidney Foundation so much, is any opportunity we have to give patients a voice and their involvement in the healthcare system, and to strengthen that, I would love to be involved in. I'd love to really give that voice and advocacy to the patient. So I'd say the tie-ins from my professional side of my life is really working with clinicians and ensuring that everybody's thinking, like, what is our North Star here? And our North Star is how do patients get the best care they deserve in a timely way, and the experience of all parties involved is strong. And I think it's a lofty goal. It's a tough goal for us to achieve as a healthcare system and everybody that's involved in it, but it's one we should never lose sight of, because that's why we're here as a healthcare system.
100%. Thank you. Thank you for sharing that. So why don't you tell me about your first experience with the Kidney Foundation?
Yeah, I think it was around 2015 or 16. And my brother, again, we were just brainstorming how we can get involved. And he's like, hey, there's a kidney walk coming up. And we're like, well, we should do that. We should get involved as much as we can. And I think it was, I can't remember the exact years, either 15, 16 or 17 and somewhere around there, where he had been discharged from hospital and he was on dialysis. And I remember we got the t-shirts, we did fundraising, we reached out to our networks, and obviously wanting to just spread the word of renal disease and what we can do to help. And I think the Kidney Foundation obviously leading that and giving some documentation and kind of resources and the descriptions of how to talk about this with people, I think was really helpful. And we're thinking, hey, this is a great organization. And when we got to the walk, I remember that day, we were sporting our t-shirts, we're all happy about it. And we started to talk to people that were volunteers as well as staff of the Kidney Foundation. And people were really friendly, people were really engaged, they were very passionate about what they were doing. Some of the things I was talking about earlier. And I was thinking, I want to get involved with this group, and I want to just anything I can do. So I started to just say, hey, like, are there any opportunities for me to get involved? Is there any committee work or just any advocacy or anything like that? And conversations kind of organically started to further along, and here I am today.
Got bitten by the volunteer bug.
Exactly, yes. Just want to give back any way we can.
So on that note, how do you volunteer with the Kidney Foundation right now?
Right now I'm a member of the strategy committee, and I've been holding that role since approximately 2020, yeah.
And what do you do as part of that role?
So the strategy committee, there's a number of us from a variety of different professional backgrounds, and we bring our brains together and we talk about some of the operational directives that are part of the current Kidney Foundation branch of BC and Yukon, and how it aligns with the national foundation. And there are a number of different initiatives that we would like to run to ensure that we meet our vision and the mission, the values that we want to portray to the public, and we want to be able to advocate for the public. And it's really just ensuring that we have context and different perspectives on the different objectives that the lovely staff such as Ramya are able to work towards. So we're trying to provide, again, we have different walks of life that we bring to the strategy committee. So we're just trying to give different lens to make sure, are the directives and the initiatives that we're taking on, are they meeting patient needs, and are we advocating for the patients? That
sounds like very exciting and rewarding work.
Yeah, it's been great so far, and I've really appreciated, and as I mentioned this a couple times, the different walks of life, and I think that's something that I've always appreciated in different professional or volunteer experiences I've had, is just learning from people, because we all see life a little bit differently. We've all had different experiences, and for a lot of the people that are involved, they have a lot of really close experiences, whether themselves or family members or friends that have gone through renal disease or transplant. So hearing their stories and the amount of passion they bring to it, I think is really invigorating for me. And I feel very fortunate to be on this committee and being able to contribute how I can.
Well, I know that we feel very fortunate, Eric, to have you on the committee, your background, your experience. So thank you for that. And what are your thoughts or advice to viewers who might be considering volunteering but haven't taken that step as of yet?
just get started. I think that's the biggest message that I would try to convey, is that there are multiple levels of involvement. There's multiple levels of volunteering, and ultimately it's, if the passion is there, and say again you have a loved one or a close contact or something like that that has any involvement with kidney disease or kidney, just anything to do with kidneys, I think whether you want to be on the street talking to the general public and raising awareness, whether you want to be developing the materials that are part of that and contributing in any way you can, lending that kind of patient voice, or whether you want to be involved at a so-called higher level on strategic discussions. I think depending on what skill set you can bring, all that matters is your effort. All that matters is your heart behind it, and how much you want to be able to contribute. I think, again, just get involved.
Everything makes a difference for sure. Thank you for being a part of today.
Thank you.